So I think this year's COSTEM is very much focused both on transplant and cell therapy. We had some excellent debates this morning about the role of transplant and CAR T cells, both in lymphoma and myeloma. This is a rapidly evolving field. We were part of the ZUMA-7 trial, and actually we published a position paper on behalf of ASTCT looking at the role of CAR T cells in second line for large cell lymphoma. I think it was an interesting debate this morning. I think the field really has moved forward, at least in the US now, where CAR T cells are approved in second line. That's actually rapidly becoming sort of the norm. In myeloma, obviously, there's a lot of work going on with CAR T cells as well, and we saw some very interesting data and future studies planned, really in upfront setting almost in myeloma. So I think we're all eager to see those results in terms of CAR T cells, both in lymphoma and myeloma. The other very interesting session this morning was on AML, and both looking at measurable residual disease, whether we should be managing that pre or post-transplant, and also looking at post-transplant maintenance. And what I was really struck is by the fact that in FLT3, which is the most common, or one of the most common mutations that we see in AML, we do have drugs, so that's actionable. But for many other patients, we can talk about maintenance therapy, but we either don't have drugs, or we don't really know how to use the drugs, or these drugs are not available for clinical trials in maintenance therapy. So I think a lot of work still needs to be done there in terms of maintenance therapy. And I think tomorrow we're going to see further discussions, both in terms of the transplant field and cell therapy, and also some work on NK cells.